Oops. Welcome to another heart-to-heart conversation. Um, I hope that everyone can hear me okay. Memo, can you hear me okay?
I can hear you okay over here in Zoom. I hope
Yes,
everything
awesome.
everything is
Ah,
okay over in
oh,
Facebook.
yes, I think so. Let me just double
Okay,
check.
perfect. Okay.
Yay! Alrighty. So you can hear me, right? As long as
I
you can
can
hear
I can
me.
hear you. I think I hopefully everything's good.
Hopefully, right? I can hear you. You can hear me. All right. Okay.
Exactly.
So, welcome. Oh, yes. Oh, thank you so much for telling us that you can hear us. Thank you so much. We had somebody already tell us that they can hear us.
Awesome.
All right. Yeah. So,
Great.
thank you. All righty. So, happy Friday. I hope you guys. I
Yeah,
we want to.
yeah.
Yes, and it's special. It's the beginning of the weekend, and the end of the week. So we are very happy to be here in another heart-to-heart conversation with you and the community. And today we are going to be presenting on a very special topic. So this is a very special topic and something that Guillermo, is very also known. Guillermo Castañeda, also known as Memo, is very passionate about, and it's a very dear topic to him. So it's on chronic pain and how sometimes stress can impact pain in us, and also the power of relaxation. So, I will introduce a little bit about him in case this is the first time you are getting to meet Guillermo. So, he is the executive director of counseling of El Paso, and he completed his master's in education with a mental health counseling concentration from UTEP, from our very own beautiful UTEP.
Right?
He also is certified. Oh, yes, and UTEP here.
There you go.
And then he also has he's certified in hypnotherapy. He can provide clinical hypnosis. He has various amounts of training in EMDR, cognitive behavioral therapy, and motivational interviewing. He helps. His approach is in believing that his approach is an eclectic one, as he believes that one size doesn't fit all. And he is very passionate about helping clients, individuals who suffer from chronic pain. We are very delighted to have you here and presenting for us today. We're going to be in for a special treat, by the way. So I'll go ahead and make that a disclaimer. There will be a portion where Guillermo Memo will do a relaxation exercise for us. So if you can find maybe a place where you're comfortable, not distracted, not operating anything that
Not
is
driving.
machinery or driving, yes,
Right.
you can put us on pause, you can leave, and then you can always like come back at another time. It's going to be a relaxation exercise. And then also just another disclaimer, of course, in doing this presentation, the purpose is to build awareness around mental health and provide support and resources to the community. It's not meant to replace any form of assessment or counseling. It's just the ethical disclaimer we have to make. So hopefully you enjoyed this very much. And yeah, welcome.
Well, thank you, Jasmine, for the introduction.
Of
I would also
course.
like to say that I'm not a doctor.
Oh, yes.
So when we talk about pain, we are going to talk a lot about what's happening in the body. But I am not a doctor, and please consult your doctor before working with your pain. Um,
Yes.
yes,
I'll be here.
sounds good. Thank you. And one more thing that we need to consider when we're working with pain. Um, we notice, first of all, we need to ask ourselves, what is pain? So pain can be very bothersome to us, but it can also, it's a message. So pain is kind of useful to let us know that there's something wrong in the body. There's something going on. It is a discomfort, but usually there is something going on when we feel the pain. For example, if we cut ourselves, if we break a bone, it's the body's way of actually telling us, take care of yourself right now. Go to a doctor and get it taken care of, and then you'll heal. So there's two kinds of pains. There's acute pain and there's chronic pain. Both of them have an impact in us. We're talking about life modification. When we have pain, it's very draining as far as energy is concerned. We're also talking about how it changes relationships. When we have pain and we cannot move, or we cannot have a relationship, so, because it affects us both in the body and in the mind. It's very physical, and I'll talk a little bit more about that in a minute. Acute pain is pain that has been there no more than 6 months. We do work with acute pain, but acute pain needs to be looked at by a doctor way more than chronic pain, because obviously there's something going on in the body, like that needs to be healed. So it could be an injury, it could be maybe a burn, maybe a cut. And when we're talking about chronic pain, we do have to realize that um, there's maybe surgery pain, there's maybe dental issues that we have, maybe even women going into labor. And that's something that can be taken care of. Hypnosis, for example, has its use in this matter, also to help the person go through maybe going into a surgery of the healing process. But basically, the body needs to heal within those 6 months. Um, Unrelieved pain becomes chronic after 6 months. And what is the problem going on over here? That, for example, my broken bone healed, but I still have that discomfort. That is chronic pain. Now, anything that's over 6 months can also be something that hasn't healed. So, for example, of an injury that has not healed, this is why it's important to actually, we do work with doctors in order for them just to check out whether the person, that pain is useful for them at that moment or not. Because chronic pain can many times not be useful anymore. Your body is actually holding on to something, and your brain is also holding on to something that has no use anymore. And that's where we actually work with the pain over here in counseling in El Paso. How do we work with it? We work with part of it cognitive behavioral therapy, part of it hypnotherapy, and part of it EMDR. So a combination of all those three, I found that it's actually very useful for the therapy. So what can happen when we have pain? Well, we can go through a lot of anger. We can go through a lot of through a depression. We can go through anxiety, even social interactions we don't have them anymore. And what can cause pain? We already talked about the body, but we can also talk about social rejection, the broken heart. When a person has a broken heart, even that's it's not really broken, but we even have that saying, it's a broken heart, because it feels like it. It feels the pain. Fear of abandonment or abandonment, grief can be felt as pain. It's important to understand that what happens to me, if I were to pinch myself, it will travel up to my brain and it will send the signal that I'm in pain. But also, when I have emotional pain, my brain reacts the same way as if I had an injury or pain within my body. Um, Things that can be chronic, can be headaches, it can be lower back pain, it can be cancer pain, arthritis pain, nerve pain. And we do realize that a lot of those issues can become quite permanent within the body. And that's why we need to start working with that kind of pain. It becomes a trauma, it becomes unhealed. And we really don't, many times, we really don't understand why that happens, but it is not useful anymore. Um, we can have also fear of re-injury and repressing our emotions. um, I used to have, this is why, as Jasmine mentioned, I'm very passionate about pain, because I used to have a lot of chronic lower back pain before. And I did realize that I had to make lifestyle changes. And I will talk about those lifestyle changes in a minute. But um, what is going on right now in the COVID-19 situation that we're having right now? Many people have lost access to healthcare. If they're telling you to be inside your house, well, maybe you don't have access to go to the doctor anymore, or to a chiropractor, or even to your massage therapist, whoever was helping you with the pain. We also lose access to healthy foods. If I go to the store, I may not find the foods that I need. And so it's like now I need to get food that is just in the shelves. And I will talk about the importance of healthy foods. We also lost access to a gym. Many people lost access to physical therapists. We lost access to connections. We're not connecting with people anymore, and that's causing a lot of pain. We need to have, we need to connect with others. Also, we change roles. Now we're adding more roles. Before it used to be more of, well, maybe I went to my job and came back home, and then that's when I became a parent. But now I have my kids at home, and now I need to take care of them. So I'm a parent, I'm an employee, I'm a teacher, and now I have everything that's providing stress. And I also have different interactions with my family. Before, I didn't see them as often, maybe, and now I have a lot of stress because of that situation. So it's important to understand why stress um, causes the pain and what we can do about it. So one thing to understand, as well as pain, is we're going to talk about inflammation. And what is inflammation? So inflammation is actually coming from Latin inflammare, which means that it's inflammatory. It's setting on fire. Um, our body uses inflammation to actually heal itself. For example, when I have a bee sting, right away I have white blood cells that react in order to actually heal my body from that bee sting. Well, what happens is that this inflammation can actually be chronic inflammation. And when this happens, it's actually it can lead to a lot of issues within my body. Um, for example, heart disease, lung disease, kidney disease, strokes, diabetes, cancer, Alzheimer's. My immune system can be impacted by it. So why are we being impacted if inflammation is supposed to be this good thing? Well, because my hormones and my body is reacting as if there's an outside threat to it. So now I have an outside threat that actually went to my body, and now it's just overreacting and taking care of something that might not even be there. Inflammation can be caused by stress, because stress can bring the cortisol levels up. What is cortisol? Cortisol is a hormone in my body that is actually there to react whenever we go through the fight or flight um, situation. So, like we talked about that in the other videos, fight or flight, we actually need it because if there's a threat, I need to move quickly away from it. But when there's a lot of stress, my mind or my brain thinks that there's a threat where maybe it's not even that much of a threat anymore. Or if it's a chronic stress, well, if it's a chronic stress, it doesn't realize that it's not a threat anymore, but it might be at the moment. Stress is very necessary, just like we talked about inflammation. Stress is necessary so that I can actually have motivation. I come here to work, and if I were not to have stress, I would not be motivated to actually do a good job. Or if I don't have stress, I might just lie down in bed all day. So stress is necessary for me to move. But when it becomes an unhealthy stress, that's when I'm perceiving things that might not be a threat to me, or I might be just in a constant amount of stress, and my and like I mentioned, that cortisol might be shut off in my body, which might create a lot of glucose that is carried around, that is supposed to be carried around to my brain, but it's just going to be so much that now my body is going to be inflamed. As my body gets inflamed, I'm going to start to feel more pain. So what do I need to do in order to lower that pain? Relaxation helps. It helps to have connections. It helps to talk to people. It helps to smile. Maybe have situations when I laugh, um, such as a comedy on TV. Maybe a comedy act. A lot of other things. I can have connections through people with Zoom, just like what we're doing right now, or through FaceTime. There is a need to actually work with that stress. So all of those things are going to help my stress lower, and that's going to help with my pain. So when we talk about what a therapy can do in order for that to happen, well, the therapists can work with the pain quite well because we can lower the stress level. Now, our body might learn about stress and we might learn not to let go. This is why hypnosis is important, because the hypnosis works with the subconscious mind, with the programming that our body and our brain already has as far as pain. EMDR, there are techniques which I am trained in that will also work with that programming, and not just the programming but also the physiological part that we have in the brain. The brain affects our I'm sorry, the pain affects our brain. it Our brain reacts way more than it should, and that's why it's hard for us to focus. That's why it's hard for us to be in a good mood. That's why it's hard for us to make better decisions. So we are actually able to physiologically create new pathways in the brain to get rid of that pain. And so yeah, I did want to explain how it worked a little bit more. And there's way more as far as explanations, but I'm just going to cut it right now because I don't want you to get bored. And I know that this is a very brief presentation. So what I'm going to do right now is I'm going to actually work with a relaxation technique, just to show you guys how it works. If you have pain, maybe you can feel some comfort from this. This is not hypnosis. Hypnosis actually It's something that we're going to do in the office or online. Right now, we're doing everything online. Um, and I like to see the person to see how they react. So remember, if you're driving or if you're operating machinery, please stop. Or you can put us, as Jasmine said, you can put us on pause and come back later and listen to this relaxation. Um, so if we can get started, I want you to just start breathing and just breathe slowly in and out. And as you breathe in and out, I want you to close your eyes. Close your eyes and feel that relaxation in your body. Feel your chest or your stomach filling up with air and emptying. More and more relaxed. And I want you to imagine that you're at a very beautiful place, very calm place, with trees all around you. And you're in a road in the middle of the trees. As you're walking, you can feel the temperature. And it's just the perfect temperature. As you're walking, you notice that there's flowers around you as well, to the left and to the right. And these flowers are your favorite colors. They could be red, purple, blue, yellow, pink. And notice those flowers and notice the scent that's coming from those flowers. As you start to walk, you start to feel more and more relaxed. At the end of the road, you see a very grassy area, a very green, grassy area. And you walk over to it, and you can take your shoes off if you want to, feeling the grass underneath your feet, feeling very grounded. And you sit on the chair that's very comfortable, a chair that's very, very comfortable, very cozy, and you get to relax. You get to feel very calm and very relaxed. And you notice your body. You start noticing your body from your head down to the toes. Notice what it feels like. You might find that there's a part of the body that might be uncomfortable. Just notice that discomfort. I want you to actually give it a grade. So from 0 to 10, if 0 was no discomfort at all, 10 is the most extreme discomfort that you can feel in your body. Just give it a grade. Just notice that. And I want you to notice that right next to a chair, is a nice chest. So you open up the ice chest and you notice that there's ice that's been melted. And I want you to reach into the ice chest and you just put your hand in there. And you notice that it's not uncomfortable, but it's actually just numbing. Just a very numbing feeling. Feeling this ice in your hand, and you can start to notice that you can't barely feel your hand. And I want you to notice just how cold it is. And go ahead and right now, physically, actually, go ahead and put your hand over the area where you felt discomfort. And go ahead and touch it. If it's your shoulder, go ahead and reach into your shoulder. And I want you to notice how that numbness is transferring over to that area of your body that feels discomfort. And you start to notice a huge relief. You start to notice that the discomfort is lowering more and more as you transfer that numbness to that area. And you start to notice how you even feel a surge of energy in your body and an even deeper calmness. And you can even tell that your breath is slowing down even more and that you're just feeling so relaxed. And just sit with that for a little bit. So relaxed. And I'm going to count from 1 to 5. At the count of 5, you'll notice yourself very much aware and just having this burst of energy for this day and for the weekend. But first, rank your discomfort from 0 to 10 and see if it lowered just a little bit. I'm going to count from 1 to 5. 1, 2, 3, 4, 5. Open your eyes. You're feeling ready for the weekend. Feeling ready for a day.
Woo! Sorry, I didn't mean to scare anybody if you were like, still in the zone. That was like really like letting out that discomfort. Wow, thank you so much. That was so good. I mean, I'm familiar with your work. Like, I know the work, but I wasn't familiar with this technique, and it was really good. And I could really feel myself, because I practiced it myself with everyone. I could feel that relief and just how it kind of brought it down. So thank you so much. It was really good. I
What
hope
was
you
your
all
first
liked it.
number?
It was a 4.
A
It was
4?
a 4. It went to a 1, but I know why. I need water. I need to
No,
drink
no,
some
but
water.
and the thing is that once we start working with the discomfort,
Hmm.
and the more we work with it, the more permanent the relief becomes. And that's the whole point.
Oh,
That's what we want to do. So for example, right now, if it was 4 to 1, we
yeah.
keep on working with it with
Uh-huh.
different techniques and with hypnosis,
Oh.
and this becomes a lot more permanent.
Mm. It's kind of like what you had mentioned earlier about physiologically creating new pathways in the brain, right?
Most definitely in your nervous
Physiologically.
system. Yes.
Wow. Well, as I hope you all very, very, very much enjoyed it. Uh, Let me see. We did have a question. I think this is the
Mhm.
first time we have a question.
All
No,
right. I
no, no,
love
no,
it.
no. We've had some before, but it was where do migraines come from? Are you familiar with where migraines come from?
Well, there are many theories behind that too, because there's of course there's inflammation. So that's
Oh,
this is more for a doctor to actually help with, but there's many reasons why the person can be inflamed. Many it's of what we eat,
mm-hmm.
sometimes what we drink, maybe the light that some
Oh,
people are more sensitive to light. So there are many reasons why the person can have migraines. That's more for a doctor to actually find out with the person. But yes, there's definitely inflammation, and actually there's a theory and a very uh, good research on that. That inflammation is the cause of everything that's going on wrong in our bodies. Every disease actually
oh.
comes from inflammation.
Like a lot of built up stress.
Well, partly it is the stress,
Okay.
partly it's the toxins that we're having.
Oh,
In the maybe pollution, maybe in
environmental.
our clothes, even environmental,
Mhm.
maybe what we eat.
Mm.
There are a
Yeah, that
lot
makes
of
sense.
factors that can bring that. Maybe
Okay.
injuries. So,
Oh, mm-hmm.
inflammation can be caused by so many things. So that's why it's important for a person when we work with pain. It's
Mm-hmm.
important for us to work in a team
Okay.
with a doctor, with a physical therapist, maybe a nutritionist. How can everybody help to bring that inflammation down to help the person as to get rid of that pain?
Right. Beautiful. Well, thank you so much for answering that question. And it is true. It is better. Teamwork always helps. Also to get because I think what like the analogy that comes to my mind. It's like puzzles, like different pieces
Yeah.
can help answer like different parts of the question. And then I just want to share with you the awesome feedback. Uh, a lot of good mornings, a lot of pleasant good mornings,
Well, good
and
morning to
there
everyone.
a lot of individuals who were looking forward to the presentation, and then also uh, somebody mentioned that it was perfect timing, that it's just what they needed, right
Oh,
before,
I'm glad.
right timing for their lunch break. So, whoa.
I'm glad.
Yeah.
And if anybody needs any help with pain, um, you know, we do hypnotherapy both in Spanish and in English,
Hmm.
and we help the person, for example, pre-surgery,
Hmm.
post-surgery. We help women that are pregnant in order to help them prepare for that childbirth. And of course, getting rid of that chronic pain because it's
Right.
very debilitating. I know the feeling. It's not good.
It's not, it's very unpleasant, right?
Horribly unpleasant.
Um, another somebody additionally thanks you for the relaxation, and they're very grateful for that. So,
Most definitely,
well,
my pleasure.
well, thank you so much, Memo. We appreciate you sharing this with us too. And then also, if you'd like to stay connected with us, feel free to visit our website. We do have a weekly newsletter where we're just sharing like resources, information. It's really for educational purposes. If you'd like to, you just need to visit our website, and then there is a portion where you can subscribe, and then all you need to do is just confirm your email, and then you'll be part of the newsletter list. But that's available to the community, and it's just for support.
Right.
It's complimentary.
And
Thank you
our,
so
our
much.
phone number, our phone number
Yeah,
is
that kind of
915.
matters, huh?
Yeah, that kind of matters. Our website is www.counselingofelpaso.com. Our
Mhm.
email is info@counselingofelpaso.com. And our phone number We're right here on the west of El Paso, Wrestler and Mesa, 6955 North Mesa, Suite 304. Telephone number 915-209-1234. Kind of easy. 209-1234.
Yes,
And thank
most.
you very much for everybody that logged in, that signed in and heard us. It's really comforting to know that people are here and people are hanging around, even after that explanation that I noticed that I went a little bit too long, but
It was
thank you very much.
beautiful. It was very
Appreciate it.
important. This is an abstract concept sometimes to be able to understand. And I think that you went it really nicely with all the different portions of it. Like I could visualize inflammation, pathways. I was like, okay, it makes sense. So thank you so much
Well, I
for that.
appreciate that. And hopefully there's going to be I do write about pain in my blog, and you're going to see this a lot more detailed.
Yeah. Yeah. All righty then. Well, thank you so much again for opening up your heart to the community. And again, this is from our counseling hearts to yours. And we're here if we're here, somebody's here. So we're here for you. And feel free to share this if you know of somebody who might be struggling with chronic pain, or they have like maybe issues related to the inflammation, and they've tried all different routes, and they kind of feel they're struggling. Maybe share them this video. Maybe this could like bring like a different light or perspective to them. So
And I will mention something else, because
yeah,
because many times and they come because they've tried everything, and I
yeah,
think that it should be at the same time as they're trying everything.
that's
So
right.
maybe even, when after you go see your doctor, come over here and try us first. You'd be surprised. That's how many people can actually get a lot of relief.
Yes. All righty then. Well, thank you again, Memo, and we are here, and we'll see you soon,
See you
community. You take
soon.
care, okay? Thank you so
Thank you.
much. Bye.
Bye bye.